How many would you say you're vaccinating a day here now?
It depends.
Yeah.
If it's a first dose, it's
They're good now,
about.
Michael. Is that all I had to do to get it go live on YouTube? Was just
Yeah, this usually
that
is.
should be it.
Yeah.
585.
It
I want to double
depends.
check this.
Like our last batch of Moderna, we got 1,000 doses, which is 1,100 doses with that extra dose per vial. We can do
But it
5.
was the,
Moderna would be 542 or 588. We got the number is based
Not
on the number of
Moderna,
doses.
Pfizer,
Pfizer.
but over 500 a day.
Right.
And then the second dose days, we're doing over 300 usually.
Yeah. Like today was like 374 second dose day.
Gotcha. Okay. All right.
This is Alan Ferguson. Can you guys hear me this time?
Yes, Alan, we
Yeah,
can.
loud and clear. We can see you too.
Wow, that's scary. That's really scary. I thought you should see my pretty face anyway.
What part of the military is helping with the vaccination up in Greensboro?
As far as I know, National Guard.
That's what I thought it was, National Guard. They were training for the shots.
140 U.S. Air Force.
It's the U.S. Air Force that's helping.
Okay.
What we understood was the National Guard were doing other things, so they've got U.S. Air Force doing those. But there's a lot of Guilford County Public Health there too.
Okay.
Some other county support from our surrounding counties.
I had an email today, North Carolina Baptist men are supposed to be helping too.
Probably.
I think,
Yeah.
you know, logistic stuff.
Sure.
Traffic and that sort of thing.
Yeah.
All right, so you ready?
Mhm.
Ready to roll?
Ready to roll.
Okay. All right, good evening, board members. At this time, I'll call the March 8th, 2021 Randolph County Board of Health meeting to order. What I'll do is go through and call your first name. If you'll state your first name and last name and signify by saying present. All right, let me go on the road. Robert,
Robert Brown here.
Mary Ann,
Mary Ann Evans, present.
Alan,
Alan Ferguson, present.
Carrie,
Carrie Hampton, present.
Hope,
Hope Haywood, present.
Julie,
Julie May, present.
Ryan,
Ryan Snipes, present.
Mac,
Max Semi, present.
Amy,
Amy Williams, present.
Courtney,
Courtney Austin Wilson, present.
and Marty Trotter, present. Thank you for being here tonight. There were no public comments signed up, so we'll close that period of public comment and we'll move on to the approval of minutes for January 11th, 2021. You should have received those in your packets. Do I hear a motion to approve those minutes as presented?
I move to approve the minutes as presented.
Okay, we've got a motion from Robert Brown. Do you hear a second?
Hope Haywood, second.
Okay, Hope, second. Thank you. I'll go back through the list again. If you'll signify by, state your first name, last name, and signify by saying aye if you approve. Courtney,
Aye.
Robert,
Robert Brown, aye.
Mary Ann,
Mary Ann Evans, aye.
Alan,
Alan Ferguson, aye.
Carrie,
Carrie Hampton, aye.
Hope,
Hope Haywood, aye.
Julie,
Julie May, aye.
Ryan,
Ryan Snipes, aye.
Mac,
Max Semi, aye.
Amy,
Amy Williams, aye.
and Marty Trotter. Aye. Thank you. Now this time we have Amy Scotton with us, and she will be going over our annual required training. And so Amy, we'll turn it over to you for a legal update. So thanks for being here, Amy.
Okay, yeah, oh, definitely, you're welcome. And I do apologize that when I'm done, I'm probably gonna get off the meeting. My Bible study group meets on Monday nights via Zoom, and so I'm gonna try and hook up with that. But before I get started, I just have one question. I had shared my PowerPoint with the health department. Do you guys have it where you can put it on the screen, or do I need to try to do that?
I have it.
And then if you put it on the screen, if you can just advance the slides as I say next slide, will that be okay?
Yes, that's fine.
Okay. Okay, so tonight I'm going to talk to you about your legal powers and your responsibilities. So we'll go to the next slide. Under North Carolina General Statute 130A-39, the local board of health has the responsibility to protect and promote public health. And accordingly, you have the statutory authority to adopt rules to effectuate that purpose. So let's go to the next slide. All right, there are some restrictions on the rules that on your authority to adopt rules. First, if an area is already regulated by the Commission of Public Health or by the Environmental Management Commission, you could adopt a more stringent rule if you had determined that a more stringent rule was necessary to protect public health. Otherwise, the rules in place would prevail. So in other words, the local board of health cannot adopt a less stringent rule, only a more stringent. Secondly, you are just prohibited from adopting rules that concern the grading, operating, and permitting of food and lodging facilities. And then thirdly, you can only adopt rules concerning wastewater collection, treatment, and disposal systems, which are not designed to discharge effluent to the land surface or to surface waters. Okay, so let's go to the next slide. Now that's what the statutes say about your rulemaking authority, but case law has been a little bit more instructive for us. So let's go to the next slide on that. Case law tells us that a board of health acts within its rulemaking powers when it follows these 5 guidelines. And the first 4 are pretty self-explanatory and easy to understand. The 5th one kind of makes you say, what does this even mean? But first, notice that the rule has to be relevant to the purpose of the board. In other words, the rule has to be related to the promotion or protection of public health. Secondly, the rule has to be reasonable in light of the health risk that it is addressing. Third, it cannot violate any law or any constitutional provision. Fourth, it cannot discriminate in nature, cannot be discriminatory in nature. And then number 5, this one that says that the rule cannot make distinctions based upon policy concerns traditionally reserved for legislative bodies. So you read that, and I know if you're like me, you say, what does that even mean? It's easier to understand it if you look at the types of rules that distinction has been used to shoot down. Basically, it's been used to shoot down rules that made activities that were legal other days of the week illegal on Sundays, or rules where you make distinctions between different types of businesses when enacting smoking rules. So like distinguishing between a bar and a restaurant for making the same rule. Those types of distinctions are based on enforceability or economics, and that is something that is considered best left to the legislature. And that's really the best explanation I can give of that. Let's go to the next slide. Oh, and by the way, if at any point you have a question in the middle of the presentation and you just want to shout it out, feel free to do so, and I'll stop and try to address it. Another thing that case law has brought forward concerns when the board decides to make a more stringent rule about something that's already regulated. Although you can do that, when you do it, you need to be able to state clearly why that stricter regulation is needed. Otherwise, it runs the risk of being shut down. Also, and this doesn't really need its own slide, but when you adopt a rule, you can adopt codes, standards, rules or regulations of other entities. You can adopt those by reference. Specifically, anything that's been promulgated by this state, another state, an agency of the United States, or a generally recognized association. And those of you who've been on the board for a while may remember that you have actually done this. Several years ago, when the National Association of Public Health Veterinarians issued new guidance on rabies control measures, this board adopted a rule that incorporated those new measures by reference. Later, when the state changed its rules and regulations to follow those new guidelines, you rescinded your rule because it was no longer needed. So let's go to the next slide. So how do you make a rule? First, at least 10 days before the adoption, amendment, or repeal. So that the process for adopting a rule, the process for amending a rule, the process for repealing a rule are all the same. At least 10 days before you take that sort of action, the proposed rule has to be made available in the office of the county clerk, which is the clerk to the Board of Commissioners, and a notice must be published in the newspaper. It also, the proposed rule has to also be available at the Board of Health. And that notice has to contain the substance of the rule and a description of the subjects and the issues involved. It has to contain the proposed effective date of the rule, and it has to contain a statement that copies of the proposed rule are available at the local health department. The rule becomes effective when adopted unless you state a different rule within the rule itself. And you're free to do that. Okay, so let's go to the next slide. So where is a Board of Health rule applicable? Rules adopted by the local Board of Health apply countywide, even within municipalities. So this is one way in which a Board of Health rule differs from an ordinance adopted by the Board of County Commissioners, because ordinances are effective only in the unincorporated areas of the county unless a city takes certain actions to allow them to be effective within the city. A Board of Health rule applies countywide. And copies of all rules have to be on file with the secretary for the local Board of Health. If someone violates a Board of Health rule under 130A-18, the local health director can institute an action for injunctive relief, or she can pursue it criminally, and violation of a Board of Health rule is a misdemeanor. Okay, so let's go to the next slide. Okay, you also, as a Board of Health, have the responsibility for hearing and adjudicating appeals. Appeals of rules that have been adopted by the Board of Health, or appeals of administrative penalties that have been imposed by the health director. Now, the health director, I'm gonna have to put my glasses on for this one because I am gonna have to read some of this because it gets a little complicated. The health director has the authority in some instances to institute administrative penalties. She can do it for anyone who willfully violates wastewater collection, treatment, and disposal rules that you've adopted, or who willfully violates a condition imposed on a permit issued under those rules. In opposing an administrative penalty, there are a number of things that the health director must take into account. Things like the type of violation, the type of waste involved, the duration of the violation, the cause, the potential effect on public health and the environment, the effectiveness of any responsive measures taken by the violator, the damage to private property, the degree and extent of harm caused by the violation, the cost of rectifying the damage, the amount of money the violator saved by noncompliance, and the violator's previous record of compliance or noncompliance. Now, this is not the only thing for which an administrative penalty can be imposed, but it is an example. And it is important to note that the health director can't impose administrative penalties for just anything. Only those violations for which it is specifically authorized. If an administrative penalty is imposed, an aggrieved person can appeal the imposition of the penalty to the local Board of Health. And people can also appeal rules that have been adopted by the Board of Health. And the procedure for both of those types of appeals is the same. So we're going to go to the next slide. And I'm going to talk through the hearing procedure, which if you've heard this talk before, you may remember is a little tight. Timing wise, it's actually very tight. So it's something to keep in mind. The procedure for conducting appeals is found in North Carolina General Statute 130A-24. And it's also outlined in a Randolph County Health Department policy entitled Board of Health Adjudication. But what happens is when a person wants to appeal a rule or an administrative penalty, they send a written notice of that appeal to the health director within 30 days of the challenged action. That notice has to include the name and address of the aggrieved person, a description of the challenged action, and a statement of why the challenged action is incorrect. So they send that to the health director. Within 5 days of her receipt of that notice, the health director has to send notice of that appeal along with any substantiating materials to the Board of Health. Within 15 days of your receipt of that notice, the Board of Health must hold a hearing on the matter. But the appellant has to receive not less than 10 days notice of the date, time, and place of the hearing. So that's where your turnaround time is really tight, because you get notice and you've got to hold your hearing within 15 days, but you've got to give 10 days notice of your hearing to the appellant. So you have to schedule your hearing really, really quickly. At the hearing, the board hears information from the appellant and from other witnesses, and then the Board of Health will either affirm, modify, or reverse the challenged action and issue a written decision based on the evidence presented at the hearing. The written decision has to contain a concise statement of your reasons for coming to that decision and inform the appellant of his or her right to appeal that. And that decision can be appealed to the district court within 30 days of the decision. So that's where I'm getting when I say it's really a tight turnaround. So you got to make sure as a board that you're really good about reading your emails, because when Susan sends that notice out, she does not have much time to schedule that hearing. if you have one of those come up. So let's go to the next slide. A local board of health may also impose fees for services to be rendered by the health department, except where the imposition of fees is prohibited by statute or where the services are being performed by the health department as an agent of the state. The fees are based on a plan recommended by the health director and approved by the local board of health and by the board of county commissioners. And the fees that are, any fees that are collected are deposited into the health department account and are expended for public health purposes. Okay, and let's go to the last slide. And just remember, as a board, you have access to legal advice whenever you need it. I've put my contact information on this slide. If it's an emergency, Susan has my cell phone number. I don't want to put that on the slide because we're on YouTube and because it's a public, that would make it a public record. But if you need me and I'm not in the office, I can be reached. So does anybody have any questions?
Hey, any questions for Amy?
Okay, great. Then I'm sure this is going to be a just runaway YouTube sensation.
All right. Well, thank you, Amy, for coming back to us every year and helping us with our requirements to have some training. So we certainly appreciate you being here tonight.
Oh, you're very welcome. Have a great night.
All right, you too. Okay, board members, next on the agenda is the Child Fatality report, and I'll turn it over to Susan Hayes at this time.
I don't have.
Oh, the one,
It's not, yeah.
oh, it's there. Oh, okay.
Okay, we're back.
Yeah.
So, bless you.
Sorry.
We always do the annual child fatality report this time of year. We presented to the commissioners in February the annual report for 2019, so I'm sharing that with y'all tonight. As of, let me back up. So each county, North Carolina has general statutes about the need to provide review and recommendations for improvement to prevent child fatalities in the state. And each county has their own child fatalities prevention team. We meet at least 6 times a month, a year. And for last year, 2020, we actually, because of COVID-19, our last meeting of the year was pushed forward to January 2021. So that's the first time that's happened, but typically we do have one meeting at least once a quarter. When we do these reviews, we're looking at deaths from the previous year. So it's a calendar year and we report on them annually. So when we looked at 2020 deaths, or when we're doing the 2020 annual report, we're looking at 2019 deaths. I'll get this out in a minute. It's confusing and I don't want to be confusing, but I'm sounding that way right now. So when we start looking at deaths this year, we're going to be looking at children's deaths that occurred in 2020. So we're already always 1 year behind when we're reviewing those deaths. So our 2020 annual report for 2019 child fatalities included 25 deaths. That's fairly high for 2019. 5 of those deaths were related to perinatal conditions. 3 were related to congenital birth defects. 3 were related to illnesses, and that can be like cancer or a viral illness of some kind. 7 were related to accidental deaths, and these are typically in this particular year, these were all related to automobile accidents. And then there were 7 other ill-defined or unspecified causes of death, which could include unsafe sleep environments, and 7 of those were related to that. So when our team looked at these, what we're looking at, were there any gaps? We have a team made up of individuals who might have had opportunity to touch these children's families or their lives in some way. We ask all those individuals if they have records on these deaths to bring them to the meeting. When we looked at those individual deaths, there were no gaps identified. What we did do, though, is we asked our Highway Patrol representative, Officer Brandon Baker, to share with us what he knows about automobile accidents that involve children, because 7 of these deaths were related to children. And almost always what we find is those children are either not in a car seat appropriately, or they're unbuckled for some reason. And so we looked at that. We do, through our Safe Kids program, provide car safety seats for children. They have to be at a certain income level to get those car seats from us. But we do continue that. We also continue other programs through the Safe Kids program, such as hot cars and that kind of thing. Thank goodness we have not had a death related to a hot car. We also provide, through our case management program, pack and play safe sleep environments. So these are portable cribs that can go to a family when a nurse or someone an individual in the community says these folks don't have an appropriate safe sleep environment for their infant. Then we can provide that for them through a grant that we've been given. And then we also partner with Randolph Health and Randolph, the Friends of the Library, and Randolph Partnership for Children to provide books related to safe sleep through their Books for Babies program. And we use the money that we get about $1,200 for the Child Fatality prevention team. And that money we use to support the Books for Babies program and the Pack and Play Portable Cribs program. So that is the Child Fatality report for year 2019. Do you have any questions? Okay, thank you.
I think Mary Ann.
Oh, Mary Ann, did you have a question? I'm sorry.
That's okay. Has your team noticed any uptick or trend up in the child fatalities as the opioid crisis has increased?
Well, we're just starting off the year so far. So this quarter's meetings are coming up. So I don't know.
But not in the past.
I'm sorry.
Not to date for the data you have yet.
No. I know that in talking with Social Services Director Tracy, we are seeing a lot of families involved in, a lot of children involved in child protection due to the opioid crisis and the COVID-19 situation in Randolph County. So that is a concern, but I don't know that we could relate any deaths to that yet. I hope not. Anything else? Okay, thank you.
Okay, next item, board members. Hopefully you were able to see your email this afternoon and the request to add the mid-year financial statements for the current fiscal year, the 2020, 2021 fiscal year. So Susan, will you be covering that as well? Okay, all right.
So I apologize if you did not see this. I will try to be clear in how I present this to you. So each year we present a mid-year financials report. And when we look at it, we want to see that if we're talking about expenditures, that we have not gone over 50% of our expenditures that we budgeted for the year. If we're talking about revenues, we want to see that we have collected at least 50% of our revenues that we budgeted. And in so far in fiscal year 2021, what we're seeing is that we are well under our 50% in terms of expenditures, with the exception of COVID-19 funding. So we have gotten several state grants that were related to COVID-19, whether it be testing or vaccine administration. And there is a push for us to spend that money timely. They don't want us sitting on that money. A lot of counties do sit on the money. Oftentimes, I will say, though, we may, like, for example, we've gotten another funding agreement, like within the last couple of weeks. We can't get that to the commissioners. It has to be approved by them until the 1st of March. But then all that money, it's about $300,000, will have to be spent by the end of May. So oftentimes they give us very short turnaround times. It's not uncommon for us to get a funding agreement from the state in April and they want it gone by the end of May. A lot of that depends on when the federal government gets the money to the state, though, and we understand that. So we've been very prompt about getting our things that we should be spending money on for COVID-19. We've been very prompt about getting those expenditures taken care of. So we're at 68% of our expenditures for COVID-19. Oh, you want to share it? That would be great. We're going to share it. I didn't realize we had these, so we could share them. So that would be great.
Which one is this? That one?
The one above it.
This?
Uh-oh. Can we flip it?
Under view, can you do it?
You can under view. Yeah. Rotate. Is there a rotate view? Okay, perfect. Woo! All right, I like it. Okay, so you can see that if we're looking at COVID-19 funding so far, what's been budgeted and what's been spent, and that's about 68% of our expenditures budget. Everything else is maybe 46% or less. And again, remember, I said it shouldn't be more than 50% mid-year. And so overall, our total expenditures have been about 42%. So we've done well with that. If you look at the table on the side there, those are funds that we requested to carry forward. And I want you to see, I want this in there so you can see what we do in terms of, you know, when the fiscal year ends, the end of May, which is the state fiscal year, everything has to be spent and in-house and paid for by the end of May, even though the county's fiscal year doesn't end until June 30th. sometimes we don't have the opportunity to get certain funds expended for various reasons. So those monies may be encumbered, and we ask to carry those funds forward. And so this past year for 2021, we asked to carry forward $257,419 into this fiscal year from the previous fiscal year, 2019-20. And that was for various things. We have monies like in Safe Kids that we can carry forward. Dental, we knew that there was a grant that we could not expend all the funds for that grant, and we're allowed to carry those forward. Same thing for the Administered grant. And then there were some reserve funds in our administration budget that we had been setting aside because we needed to purchase a new dental health medical record. And so it's called Dentrix. And so that was fairly pricey. And rather than going to the commissioners and asking for that money, anytime we can set money aside knowing that there's something we want, that's what we do. And that was why we asked to carry that money forward. So just so you know, we try to plan for things like that and be able to pay for those things out of our own budget rather than having to ask for funding. And that was one of those situations. Can you go to the next one?
Go down.
Maybe, I'm not sure. Yeah. So were there any questions about what we just covered? Okay. So here are our finance revenues and in brief. And what we want to see again mid-year is that we've collected at least 50% of the funds that we said we would. And so if you look at this for administration, we've collected 91%. But then if you go down and look at, let's look at Smart Start funding, that's only 37%. And some of that is because we budget out how often we ask for money for, this is a nurse who's funded by the Partnership for Children. And so quarterly we will ask for money. And part of that's the reason why you don't see that 50%. Another reason there is we also, when our child care consulting nurse, when she does training like for shoot, all I can think of is cardiac arrest. Y'all, my brain, I am getting too old for this. CPR, thank you. You're supposed to laugh, it's funny. I am getting too old for this, but so cardiac arrest, good grief. So for CPR training, when she does that kind of training, she will, there's a cost involved because we have to pay for the books, and it's American Heart, and they charge us for those books. So she recoups her costs for those things. And so we didn't do any of that this year. And so that's another reason why those revenues are a little bit lower. When you look at dental health, our Medicaid settlement, it was lower than we had projected. But when you look at dental health in terms of the amount we projected, when we budgeted for what their income would be, it's 90%. And, you know, Medicaid cost settlement is what the state asks that health departments be settled for the cost of their services, because our services, we never get reimbursed for what our services cost, because we're a safety net provider, and we often, you know, we see people who can't pay. So the state will settle with us for what the services actually cost us. And Medicaid approves for the state to do that. And that is what that is talking about. So $39,000 versus $114,000. You can see that environmental health is right on target, and that health education, those fees are typically for car seats, honestly. Car seats, and there's grants in there. It's not just car seats. There's lots of grants that we get, minority diabetes prevention program, Safe Kids, which is the car seat, several other grants that we get, and that's what that is. You can see that most of the rest of those are pretty close to what they ought to be, except for maybe local revenues is 39%, but we always try to make that our last resort. We try to make sure that we're getting revenues, because those revenues, what you're seeing in local revenues provided, that's money that the county is having to give us to keep our programs going. So we want to get money from all these other places first. School health, go back up there and you'll see 15% for school nurses. The reason that's 15% is we have to invoice the schools each quarter. And so they have to pay us. We're the pass-through for that money. So each year we get $250,000 to help pay for school nurses. The Ashford City schools and Randolph County schools, we invoice them and say this quarter, I take that back. They invoice us and say this quarter, this is how much we've spent on our nurses. So we have to pay them. If they don't invoice us, then we've not paid them yet. And that's why that's 15%. They've not invoiced us. Now we remind them to do that because this is money we want them to have. We can't use it. The state wants it to go to them, and we'll get caught up by the end of the year. But that's why that's 15%. So any questions about that? Okay. And then the next one we'll look at, oh, and it's the right way. This shows you what our revenue sources are. And we think you would like to see that because it shows that about 47, 48% of our revenues actually come from local government. 30% are from federal and state government. About 15% comes from Medicaid. We collect about 5% of our revenues come from fees. About 3% comes from grants. Sometimes we get donations. We have not gotten any. I will say that our grants have gone up over the years, the last 5 years. Now this past year, not as much, though dental is knocking the ball out of the park because she keeps writing grant proposals and keeps getting them. So we've got an eye on a Duke Endowment grant that we think we will get this year. So we'll keep you posted on that she's written a proposal for. So that's where all of our monies come from in terms of source of our revenues. And then where's the other pieces like this? It should be the next. Okay, if you'll go back to the front, back to your desktop, and it'll be that one. And these are the expenditures by program, and you can kind of see what we budgeted, what was spent. That was on the front page. Just another view. I don't think that's really any different. If you'll go down to the next one. Keep going. This is fees. These are our revenues by fees. And so you can see that we should have collected at least 50%. Our family planning numbers are down because we are not able to do 100% of our services now. So far, about 32% of our fees have been collected there. And probably the same for food and lodging, because of restaurants. There's not as much going on there because of COVID-19. And of course, if you go on down, Ernie, see that our mid-year financials shows that we have seen a decline in some of our fees that we have collected. And then if you go one more, this shows revenues. This shows Medicaid, what we've earned in Medicaid, and we've done relatively well here. Again, I would like for you to notice child care coordination, our case management programs, that's 50%. Our general clinic has continued to collect fees for the things that we do there, like TB skin test or pregnancy tests, those kinds of things. And dental, again, 87% of her revenues she's collected so far already. So that's good from Medicaid. And then Medicaid funding for family planning, that's pretty good, 44%. Pregnancy care management, which is the pregnancy part of the care management program, about 51%. And then our cost settlement fees, Medicaid revenues are off a little bit. And that has to do with the year. And that is the end of that report. Does anybody have any questions?
Any questions on the mid-year financials? Susan, I think that one part where you're able to carry funds forward, that's probably huge for you guys, because a lot of times you'll see, especially with state and federal funds, it's either spend it or lose it. And so the ability to carry some things forward and spend it as you need it, that's huge. And not just spending it to be spending it for the sake of doing that.
Exactly. And some of that, again, is we know that we didn't need this money for whatever reason, right, and we've got it there, but we're going to use it for electronic health records or something.
All right, any other questions or comments on the mid-year financials? Okay, moving along. Still Susan's up, and we'll talk about the COVID-19 update from the health director's report.
Okay, so far right now, we've had about 13,540 total cases since the beginning of the pandemic. And I will say that this past week marked our 1-year anniversary when we opened our public health emergency operations center. We started out in this room, and then we moved over to the EOC. And about, when was it, Tara? We moved back here.
5 or 6 weeks ago.
So about 5 or 6 weeks ago, we decided when we started ramping up with vaccines, it became more difficult to manage cases and 2 operations at one time and be in a different place. And vaccines became such a focus that we moved our operations back here. Now, we've not closed our public health emergency operations, but we are all in this location now rather than in 2 separate locations. We've had 205 deaths, 207 actually, 207 deaths, and that were related this year. This is for the whole year to coronavirus. And these are deaths that we have positive COVID-19 test results for, and they are positive cases that never improved, and the cause of death was related to COVID-19. So 207. We have 6 long-term care facilities that remain in outbreak: Brookstone, Alpine, North Point in Archdale, Crossroads, Westwood, and Claps. Most of those will be in monitoring through this month, and 2 of them are going to be monitored through the first of, well, actually 1 of them will be monitored through the 1st of April. Then we also have an outbreak in our detention center, which will continue monitoring until April 12th, unless they keep having positives. If they have a positive staff or a positive resident, then that pushes their 28-day monitoring out from that date of that positive. So it can continue to keep going, but hopefully it won't. Hopefully these will get resolved within the 28 days that they have right now. We are also at a 7% positive rate. The good news is that we've been seeing a steady decline in the last 4 weeks of our positive cases. So as of January 30th, we had 397 and we were at a 12% positivity rate. As of February 27th, we had 176 positive cases and we're at a 7% positivity rate. So that's good news. We're seeing that decline. The state is seeing that decline as well. The country is seeing a decline, but there is cause for concern in that a lot of states are lifting those mask mandates, and that concerns us because people travel. If everybody stayed where they are, it wouldn't be a problem so much, but they don't. So that is a concern, and we hope that we don't see these numbers start to go back up. We hope we continue to see them decline. I think North Carolina right now is at a 4%, 4-point-something% positivity rate, and that's wonderful because that's below 5%. We've dropped to 7%. They do this on a weekly basis. Wednesday, we will get another report of our positivity. It comes out every week on Wednesday. We are now an orange county versus being a red county. And again, that is based on our positivity rate, the number of positives we get, the number of folks who are hospitalized. So as that continues to decline, we can hope to see that we will move from an orange county to a yellow county. So that would be great. So that's kind of where we are right now. Any questions about the situation, the COVID situation in Randolph County? So I'm going to ask Tara. Tara is the vaccines has been her. She's the point person right now, working with our nursing leadership on vaccines. And I'm going to ask her to give you an update on vaccines.
Hey, everybody. It's hard to believe that my memory serves me right, that it's been a year since we've met in person. I think our last in-person Board of Health meeting was a year ago this month. So we sure are ready to get things back to normal and get back to in person because we kind of like you guys a little bit and are ready to see you again. Before I get into a vaccine update, I'll give you guys a brief testing update. Testing is declining. StarMed Healthcare, who's the vendor that we've been partnering with since last summer, for a period of time, I can't remember how far back it goes, maybe late fall, early winter, they set up testing sites at RCC in both Archdale and Ashboro, and they were offering Monday through Friday testing. Well, since the beginning of February, testing has dropped dramatically and they have cut back on their testing. So At this point, they are doing testing in Archdale on Tuesdays and Thursdays from 10 to 2, and they're offering testing here in Ashburn on Mondays, Wednesdays, and Fridays from 4 to 7. They also continue to offer testing in Liberty on Saturdays at the First Baptist Church from 11 to 3, I believe. So switching gears to vaccine. This week marks week 13 since vaccine distribution started in North Carolina. Randolph County Public Health has received vaccine 11 of those 13 weeks. Randolph County Public Health has received a total of 8,785, or has been allocated 8,785 first doses in that time. We have not yet received our doses this week, but we will be getting 1,170 Pfizer doses probably tomorrow or Wednesday. Just to give you guys a few more numbers. In the 13 weeks since North Carolina has started allocating vaccine, the state has allocated a total of 1,921,560 doses of vaccine. First doses, I said, and when you look at the state as a whole, there's 10.5 million residents in North Carolina. A little over 2 million of those are under the age of 18, which makes a good portion of those ineligible for the vaccine. Pfizer is the only vaccine that can be given to anyone 16 and over. Moderna and Johnson & Johnson, you have to be 18 or older to get it. Anyway, my point being is that the 1,900,000 first doses, that's about 23% of what North Carolina needs to get adult population vaccinated. I will point out that that doesn't include any of the long-term care facilities, because that vaccine, I don't believe, was factored in to those numbers.
No, because it comes from a federal program.
Yes, that's right. And those numbers also do not include the vaccine that the Walgreens are getting. That's coming directly from the federal government. Those numbers also don't include the new Johnson & Johnson vaccine that is coming on the scene this week. Since we last met, we have been really busy with vaccine. Since we've met in January, we partnered with Randolph Health to help them use up some of their vaccine that they had on hand, and we held 2 vaccine clinics, drive-through clinics at the North Carolina Zoo. We held an event on a Saturday and Sunday in mid-January where we were able to do about 2,000 doses in those 2 days. When we evaluated the situation to plan for the next second dose event, it was determined that we thought we could pull that event off in a one-day event, and we were able to do that. So early February? Early February, we held that second drive-through event at the zoo, and were able to do 2,000 second doses in a day. So that was a great partnership between the hospital, Randolph County Emergency Services, the zoo, the sheriff's office, us. It was a really big team effort, and everybody worked well together, and we pulled it off. At this time, we are scheduling appointments and offering vaccines for groups 1 through 3. So the pool is getting larger. So we're providing vaccine to healthcare workers, those that are 65 years of age and older. And then group 3 is probably our largest group so far, and it includes childcare workers, school employees, and then all other frontline essential employees. That includes manufacturing, veterinarians, even dry cleaners. I had somebody call and ask me if they were eligible. Agriculture workers. It's just a large group of folks, and we are currently working to schedule and fill our appointments for this week. Total vaccines administered as of end of today, March the 8th. We here at Randolph County Public Health have administered 8,148 first doses, and we've administered 4,229 second doses. I do want to take an opportunity real quick to brag on our folks. You know, when the winter weather hit the United States a couple of weeks ago, or mid-February, it delayed our allocation of 1,000 doses of Moderna. We didn't get it at all that week. And then the next week we were allocated 1,170 doses of Pfizer, and both allocations came in 1 week. And the state has given us certain expectations that when we get vaccine, which usually arrives on Tuesday or Wednesday, they want that vaccine to be used in somebody's arm by the following Monday. So we had 1,000 Moderna doses plus 100 for the extra doses in those vials, plus 1,170 Pfizer vaccines. We had from Thursday to Monday to get rid of that vaccine. So our folks did what we normally do on Thursday and Friday, which is our first dose days, and we knocked out the Moderna, 550 doses a day. That left Saturday, Sunday, and Monday, and we worked really hard not to do events on weekends so our folks can have a life outside of here, since we are doing vaccine clinics almost every day, Monday through Friday. So somebody had the bright idea of, well, let's do 1,170 in 1 day. So we planned that. So last Monday, March the 1st, with a partnership with the Sheriff's Office, EMS, us, and the county schools were gracious, as was Soil and Water, to tolerate us bringing all those people on site. And I need to mention maintenance. They were helpful as well, as was Randolph County IT. But we were able to administer 1,170 first doses a week ago today, which is an amazing feat. And we've got a great team, so want to shout out to them. I'll just quickly mention that there are a total of 10 approved vaccine providers in Randolph County. So in addition to us, there's Randolph Health, Prevo Drug, Zoo City Drug. I know I'm going to miss somebody. White Oak Family Physicians. There's other places for folks to go to get vaccines. So if folks ask you or say they have a hard time getting through on the public health appointment line, direct them to those other entities, or they can go to myspot.nc.gov and find testing sites. They just plug in their city or plug in their zip code, and it'll pop up some vaccine sites in and around where they are. I will mention, like I mentioned a minute ago, we are doing vaccine clinics most every day. Our goal is to use our first doses on Thursdays and Fridays so that we can use them by the deadline. And then we are doing second doses on Mondays, Tuesdays, and Wednesdays. Our folks have been doing this for a number of weeks now, and as you can imagine, they're getting pretty tired. No grumbling or complaining, they're amazing. But we are talking to, and we are looking at partnering with StarMed, who has been our testing vendor. They are an approved vaccine provider. So we are looking at them partnering with us and supporting us to do our second dose appointments. We're hoping to move to that late March. They will come here and they will offer those second doses here on site. We will transfer vaccine for them and assist them however they need, but they will be doing traffic, they will be doing check-in, they will be doing the vaccinating, they will be doing the monitoring, and that will free our folks up for them to catch their breath and actually do a little bit of their other work that has kind of gone by the wayside during COVID. Did I miss anything to think about? I think that covers a quick vaccine update. Does anybody have questions about that's vaccine related?
Tara, if StarMed helps, will they schedule as well, or will we continue to handle that?
That's one of the little kinks we're trying to work out right now. We've been telling or asking folks, that have come through already that StarMed's going to be helping us with. We've been saying just come back on this day at the same time. We're finding that there's some hiccups with that, so we're actually going to help them with scheduling those second dose appointments. And it will also help us if something were to happen and fall through with StarMed, we'll have those appointments on our books and we can just step right back in and continue with those second dose appointments.
Okay. And I'll say to anybody that's from the Archdale Trinity area, Archdale Drug is an approved provider.
And let me go through, I've got them written down. It's, because I don't want to leave anybody out. Archdale Drug is an approved provider, Mercy Family Health Care, Mercy Urgent Care, Prevo, Randolph Drug, us, the hospital, White Oak Family Physicians, and then the two Zoo City drugs here in Asheboro.
Well,
we would love to see more providers get on board.
only the Zoo City drug out on 49, Zoo City 2 is given the vaccine.
Yeah, they're both approved, but you're right. Only Zoo City is receiving 100 doses this week.
Because I went over there the other day and just asked them when, you know me, when I'm out and about, I just ask, what are you doing? What's happening?
Yeah. And this week, 7 out of the 10 approved providers is getting vaccine. We, Randolph County Public Health, since the beginning, we've been receiving about 50% of all of the vaccine that comes to Randolph County.
Tara, Alan Ferguson, I just wanted to say I came through the health department for my first shot on the 25th, and it was really an impressively smooth operation.
Thank you.
I mean, I knew it would be good, but I was actually surprised it was so smooth and quick and just one of the most efficient things I've ever been through, honestly.
Thank you, Alan. Our folks are, we're a well-oiled machine. We'll brag on ourselves. We've got a good team and they're good at it.
It looked like it.
Tara, do you think once Johnson & Johnson's vaccine becomes more readily available, more places will be able to offer it?
That's our hope. You know, Susan and I, we've talked about, we don't know that we'll ever see Johnson & Johnson because, you know, we've gotten pretty good at being able to store and handle Moderna. We've been able to handle and store Pfizer, which is a real treat since it has to be stored on dry ice since we don't have the refrigeration freezer requirements as far as that goes. The Johnson & Johnson clearly will be an easier to store vaccine. And with it being a single dose, hopefully some of the other providers in the community that will draw them in and be more appealing to them to onboard themselves and become vaccine administrators. Anything else? All right.
Okay, thanks, Tara. Susan, you want to speak?
That's one comment.
Okay.
I just wanted to finish up by saying just a couple of things. Our staff have done an outstanding job. We have a local county government where we work so well together as a team. Public health could not do this. The vaccine clinics that we do, we could not do these without emergency services, IT, county IT, the sheriff's office has helped us in our maintenance department. EMS and IT have heavily supported us during this vaccine push. So we are very, very grateful to them. But I personally am most grateful that we come from a culture where we like each other, we work together well, and we know how important it is to support each other. And that is what Randolph County is. And I don't think you find that everywhere. And I'm just so proud of our team and our folks that we work with. They're top notch in my book. So just want you to know how good we all are at helping each other and how proud we are that I am, public health is, that we have that kind of relationship with our coworkers. And that's all I got.
Got a quick question for you. I know it's not related to COVID. When are we starting our accreditation process? I know it's about now. It's coming up.
You just have to bring up bad things at the end.
Well, but we have to think about it.
Yes, we do. We have gotten a reprieve on our accreditation. They have pushed it back another year.
So we're, yes.
Yeah, it's been pushed back another year. So they're giving all the public health departments in North Carolina another year grace period. So we're good right now. That is a great question, though. Because we start getting really upset about, you know, and anxious about meeting all those things that we have to, all those hoops we have to jump through. But thank goodness we can wait for another year.
Thanks for that update.
Yes, sir. Thank you for asking.
Good question, Robert. Anybody else for Susan or Tara?
Could I just make a statement?
Sure.
Okay. I just wanted, since this is a, you know, the Public Health Board, I just wanted to make the statement that really and truly the fact that our hospital is in bankruptcy during this pandemic and during this vaccination period, that has really shown a spotlight on how badly we need, you know, the hospital. With this huge vaccination effort, the hospital has been great. They've been a great partner, but because their resources are stretched so thin with the, you know, with the staff that they have and having to provide COVID services, then they have not been able to get out the large amounts of vaccine that hospitals in other areas have, because they're dealing with the impact of COVID and the impact of staff that's left during that bankruptcy period. So they've done all that they can. They've worked with public health. They've worked with other providers. They've been wonderful to do what they can. But that's been limited because of the bankruptcy situation. So I don't know how many of you have seen it, but Angie Orth turned in her resignation today. But the company that's buying the hospital, the man that's buying it already has hired someone. He's from Watauga County, so he is a North Carolinian and worked at whatever the health care is. And Julie, he's the one who hired William Baird away from us. He was the, you know, the maintenance director at Randolph Health. And so he hired William away from us. I said to him when I met him, you hired our neighbor for your maintenance. He said, oh, William Baird. Yeah, we got a good one. I said, yes, you did. That's what I hear. But
That was
anyway,
a thing.
so he's already in place and, you know, we'll be starting. So I will tell you, it is not looking like the local government commission will let us borrow the money, but Mr. Sarian is very committed to coming regardless. Okay, he is very committed. He likes what he's seen. He feels like there's great potential there, and he is committed to being here. He's been paying Tim Ford for a few weeks now. So, you know, for him to be, everything we see indicates he has a strong, strong commitment and will pursue some more creative financing. And if that's the case, then the county will do all that we can to help. So we'll see where that goes, but I know that that's out there. People will be reading it. And so Angie, he had talked to her about remaining, but she is worn out. So I think she is very amenable to helping with the changeover, but she is ready to go, and I understand that. So, so anyway, that's just a little bit about where we are with that.
And I just want to speak that Angie Orth has done everything I've seen is an amazing job. I think we were very blessed.
Yeah, she has. If you look at the finances, I mean, Mike Sarian made the statement in a meeting the other week that if you look at the finances, that if it weren't for paying all the bankruptcy attorneys and, you know, all of the consultants, that it would be profitable now. So you get the debt out of the picture and you stop paying all those people, then you can get down to some real business, I think, and that is providing health care for our citizens and taking it up a notch, you know. So so I wish, I would like to think that that loan would come through. The county is certainly willing to, to take it. We have voted that way. We're absolutely willing to take that on, but we can't borrow money without the local government commission's approval, and it doesn't look like right now that's going to come. But at the same time, as I said, he is very committed to being here. And so for somebody who's done what he's done and worked with 30 hospitals, turning them around, for him to be that committed, I think he sees potential here. And so that excites me.
Okay, anybody else? Thanks for sharing that, Hope. That's the end of our agenda, folks. So if I can hear a motion that we adjourn the meeting.
I move to adjourn the meeting.
Do I hear a second?
I second the motion.
Okay, Courtney, thank you. I'll go through the list, and if you'll just state your name and signify by saying aye that we adjourn the meeting. Courtney?
Aye.
Robert?
Robert Brown, aye.
Mary Ann's left. Alan?
Alan's on mute.
Alan Ferguson, aye. Sorry.
Thank you. You're fine. Carrie?
Carrie Hampton, aye.
Hope?
Hope Haywood, aye.
Julie?
Julie Mae, aye.
Ryan?
Ryan Snipes, aye.
Matt?
Max Summy, aye.
Amy?
Amy Williams, aye.
And Marty Trotter, aye. Folks, thanks for your time tonight and appreciate all that you're doing for us and look forward to seeing you next time. So thank you.
Thank you, everybody.
Everybody
Bye-bye.
stay safe.
Dude. There's some rule about local governments being able to borrow that kind of. The problem was, I don't think it was a loan. Yeah, but I forget, there was some glitch when most